Good afternoon, everyone. Thank you for joining us for our discussion on COVID-19. Today's town hall is falling at a critical time because the flu season is now upon us, which means that we have to be extra vigilant and careful about stopping the spread and protecting ourselves and our loved ones. So we are encouraging you, please don't yet relax the standards and the practices that we know prevent the spread of COVID-19. Those are practices like staying home when you can, keeping 6-foot distances or more, and wearing when you're venturing out, and most importantly, wearing a face covering. We know that COVID-19 is not going away anytime soon, as the ongoing case numbers and certainly the national headlines of the day indicate. We know that everybody wants to get back to normal. I think Matt and I feel that way very strongly, as do our colleagues. But we need everyone to stay on the alert and to be committed to stopping the spread. So for today's discussion, we are glad to welcome several members of our county's leadership team. So we've got County Manager Mark Schwartz with us, our Deputy County Manager Jim Schwartz, Dr. Aaron Miller, our Director of Emergency Management, and our Public Health Director, Dr. Ruben Varghese. Matt, over to you.
Great, thank you, Katie. Before we get started, just a few highlights. Here in Arlington, we continue to hover around a 3 to 4% positivity rate, and we still have community spread of COVID-19. We'll hear more details about that from Dr. Varghese shortly, our Public Health Director. Over the last several weeks, we've added testing capacity in our community. We're also holding 2 more pop-up testing events on October 8th in Buckingham this next week, and October 17th in Green Valley, in a continuation of our health equity pilot work. The county is finalizing a guidebook to restaurants with winterization strategies as the weather gets colder, and information on how to seek permission for outdoor heaters and temporary tents to assist with the transition that's coming as we turn towards winter. For safety, there are restrictions and limitations on the placement of outdoor heaters relative to building tents, canopies, and awnings. Our public health staff are also continuing our contact tracing efforts, and we encourage everyone to answer the call, pick up that phone if you're contacted by a contact tracer with our public health department. We know something that's on the minds of hundreds, probably thousands of Arlington children: Halloween. Yesterday, the county put out guidance on Halloween, which is available on our website. Keep in mind, much as your kids might tell you, Halloween isn't an official holiday, and it's not regulated by the county. However, we are asking everyone to practice the behaviors we know slow the spread of COVID-19. There are higher risk activities, traditional trick-or-treating, where treats are handed to children who go door to door on large costume or neighborhood parties. Those are higher risk. We also have lower risk activities, carving or decorating pumpkins outside at a safe distance with neighbors or friends, or having a scavenger hunt style trick-or-treat search with your household members in or around your own home, rather than going house to house. Maybe even a socially distanced costume parade. Those are lower risk. Ultimately, there are still ways to celebrate Halloween, but we really urge everyone to do so on a more limited, safe scale. Trick-or-treating the standard way is not recommended, as it involves increased risk of transmitting COVID-19 because of the potential of the close proximity to many people and the difficulty for children to follow mask use and social distancing requirements. If you do choose to trick-or-treat, protect yourself and others by following the Virginia Department of Health recommendations. Over to you.
Thank you so much, Matt. Do you know what your neighborhood's going to do to have a safe Halloween?
I don't yet. It's a new enough neighborhood. I'm in week 3, so we will find out over the coming days.
That's fantastic. Well, I think our neighborhood's thinking about doing a Halloween parade, and I know my little son is excited to dress up as a mail carrier, or at least we're excited to dress him up as a USPS mail carrier, so hopefully we'll be having that parade. All right, so let's jump in with some questions. Just a reminder, you can submit comments in the Facebook chat, which is streaming now, and participants can, of course, also text their questions, 571-348-3053. We will do our best to get to as many questions as possible. So let's launch in with the numbers. Dr. Varghese, how are we doing on our public health metrics?
I thought I would show people maybe a chart that everyone's grown familiar with, if that's okay. I think a picture is worth 1,000 words here, so let's see. Hopefully you are seeing a graphic. This is the data through September 26, 2020. We do it on a weekly basis. And at that point, we had 3,941 new cases. We're above 4,000 for this week. But the important point, once again, is, as Mr. DeFioranti had already said, we still have community transmission. And if you look towards the weeks in September, we're still seeing that we still have cases in all the age groups, although the three age groups that have the most cases are those 18 to 29, those 30 to 39, and those 40 to 64. So I think the message, once again, is we have COVID and keep up the good work. Stay at home as much as you can. And as Mr. DeFioranti talked about Halloween, there are safer ways to participate in Halloween, and you can still actually get dressed up. But the one thing I want to remind people is the masks that come with Halloween costumes are not appropriate to prevent the spread of COVID. So think about decorating your face covering as the way to actually do your costume work this year. Back to you.
Thanks so much, Dr. Verghese. Matt, would you like to jump in with the next question from one of our residents?
Sure, happy to. So there was a question that came regarding, that's a follow-up regarding apartment dwellings and whether the county has reached out to encourage safe practices for masks inside multi-unit buildings. And I can give a little bit of a sense. I think maybe either Mr. Schwartz or either James Schwartz or our manager, Mark Schwartz, can certainly follow up. But just we have reached out several times with letters, and we also have done some calls, as I understand it, to make sure that in those multi-unit buildings in the common areas and the hallways, people are wearing masks and being safe. Mark Schwartz or Jim, did you want to follow up at all on that one? Let's see.
Yes, I'll grab that one, Mr. DeFioranti. Sure. You are largely correct. We've reached out to multifamily dwellings a number of times, but we are currently trying to figure out what we can do to sort of change that up. Clearly, the question keeps coming up, so it tells us we're probably not being as effective as we would like in our messaging. And so we had a brief conversation on this very topic earlier this week, trying to figure out if there's another way to go about that messaging. So look for more of that here shortly.
Great, thank you, Jim. That's helpful. Both we have done quite a bit, but we also are working on doing more. And I actually have had a conversation in the last 24 hours with the manager, in addition to what you mentioned in your brief meeting. So we are working on apartments and multi-unit buildings. It's a source of concern, and we're seeking to follow up. Katie?
Thanks so much. So a bunch of questions about contact tracing. Let me jump in with one of the more tactical ones. These are probably both for our public health director. So Ruben, could you tell us a little bit about what people should expect if they're contacted by a contact tracer? Do they walk us through the nuts and bolts of what people can expect if they're going to be connected to a contact tracer?
Sure, that's a great question. So first of all, when you get connected, you'll see a number. It'll be 703-228, and then it could be any numbers after that. That is what you should be looking for from a contact tracer from Arlington County. And so anything else like that, not appropriate. I think we can put into the chat box, hopefully, also, we do have information of what to look for to prevent scams. We don't ask for things like social security numbers. We don't need tax ID numbers. We're trying to find out who you may have been in contact with, plain and simple. We don't need bank account information. And yet there have been scams like that across the nation and even here. So that information is available on our website as well. So what we're basically going to do is our case investigators, first of all, talk to the initial case, learn who they've come in contact with, and then based on that, we find ways to identify the contact information of those contacts. We call them, hopefully they'll respond there's a window we usually get to people between 24 to 72 hours, depending on their availability. And we talk to them. We try to first make sure that they don't have symptoms, because if they do, then we have to worry that they're actually cases. But most contacts are not going to be symptomatic, and we're asking them to stay put. And most people have been cooperating with that. I saw a question possibly about the COVID Wise app as well, which is available through the Virginia Department of Health. And people who sign up for that, they're not contacted unless we identify a case. And then what happens is it's really dependent on where that case has been. And so we give that person a PIN number that they enter into their app. That app then determines, in a sense, who they've come in contact with in a certain period of time, and that's how the notification is done. So if you don't get notified, at least that one case isn't the source. The problem is, of course, not everyone has the app. So obviously you can actually sign up for it if that would be helpful.
Thank you. Do we have a sense for our own efforts or the state efforts, how well contact tracing is working? I know it ebbs and flows a little bit when something's really reaching community-wide transmission. Sometimes the contact tracing is less helpful than it might be at the beginning or end of the pandemic. So help us understand what kind of difference contact tracing makes.
Sure. As a general rule, at least at the beginning when we were starting to move up the curve, depending on the resources, if there are that many cases, we will then often focus on the cases versus contact tracing, because at the height of it, it's really hard to get enough people to even just talk to the cases. And that's true across the nation. It's a volume thing. We don't have everyone available as people may imagine. And having said that, Arlington's been very good about having the resources to, better than most communities, to do the case investigation and then followed by contact tracing. And contact tracing is even more effective as numbers come down, because the purpose of contact tracing at that point is to keep people inside, if at all possible, so that if they are at risk for asymptomatic transmission, they're going to stop that spread. And as numbers go down, that's when contact tracing becomes the most effective, because we're really trying to stop it in its tracks. And that is what we'd like to one day get to.
Thank you.
Great. We've got a question here that's come regarding property and real estate taxes. And I just want to, this has come up in several town halls, but want to kind of touch on this because there's a little finer point. It's the folks who have lost their jobs, and unemployment insurance has been a little bit delayed. We do have resources that can help, a couple of different ones. First, if you are concerned about eviction, or then we have a set of resources that's 703-228-1300. That's 703-228-1300. But for other Arlingtonians, a lot of our resources are provided through Arlington Thrive, and that is another place that you can, another point of entry for the county's relief efforts. And then but there are others who have been unemployed and may need more time in order to pay your property taxes. And there is a process for doing that. I think we can put in the chat a link to that. And I don't know if there's any more detail on that. I think it's through the treasurer's office that it would be provided. Jim, did you have anything to add on that, or just putting that information in the chat work? It's essentially a way to pay your property taxes over a slightly extended period of time. I think that covers it. We will we'll seek to put that link in the chat. And Mark Schwartz has appeared. Did you want to add?
Yeah, Mr. DeFerranti, I think you're making reference to, there's a program that the treasurer's office has, where our treasurer has worked with local bank to set up a loan assistance program. And I would encourage people, if they have questions, to go on the website. And if they are prepared to come in person and ask, there's literally almost an army of people here in the Bosman building on the first floor, plus the Thomas Jefferson Community Center is a remote location for people to go where they can ask questions or make payments.
Great, thank you, Mark. Appreciate it. We'll add that in the chat when we can.
Great, thank you. Yeah, and I think too, just that point about our cash assistance program for those who are having trouble paying rent and utilities is so important. So I'm really glad you emphasized that, Matt. For a lot of people who are renters in Arlington, that's the way they can get relief from us rather than a tax relief or property tax relief program. All right, so a very good question about nursing homes. And I know that that is a key topic for the state. And again, ask Dr. Verghese to help us out here because I know that this has been a major topic of conversation among all the public health directors. So specifically the question was about restrictions on visitation. How much of that is determined at a nursing home by nursing home level and how much of that is set by state policy?
Sure. Great question, Ms. Crystal. It's really guidance. There is very little that we're allowed to actually restrict at certain points. It'll be related also to the governor's orders. So as a general rule, each facility can decide for itself what it thinks is appropriate for their residents. Obviously, public health will make recommendations. I'm on the more conservative side. I will recommend to people to do more testing more frequently because they're a more vulnerable population. And then it's up to the facility to decide if they're going to allow visitors, either letting the residents leave or letting visitors come into the establishment. If they choose to do that, I'm trying to remind people that just because you're allowed to visit doesn't mean you couldn't still keep 6-foot distances and that you should be using face coverings in that sense if you visit the facility. Likewise, if a resident were to leave, that they need to realize that they need to protect themselves and they could then become a source of infection in their own facility if they're not following the right precautions. So it does take a community to protect each other. And so I'm going to keep recommending as much as possible stay at home. And I realize that for morale and for mental health, sometimes it absolutely makes sense to have the visitors, but follow all of the recommendations we've been making.
Thank you. And so it sounds like we, as at a policy level, we may not have answers for the individual practices of nursing homes, but it probably is because they're trying to follow those efforts to keep everyone as safe as possible, particularly given the way that we've seen the virus spread within the nursing home environments. All right, Matt, over to you for the next question.
Sure. We got a question a little bit earlier regarding parking and in the balance that we're trying to strike with TOSAs, temporary outdoor seating facilities or areas, excuse me. The question is whether the timing that parking regulations would end, we shifted that from 6 o'clock to 8 o'clock, I think 2 budgets ago. And the question is whether we can shift back that timing. That is not one that we have yet considered in detail. This both mentions the possible health benefits of not touching meters, and it also suggests helping with consumer activity, folks eating out. I'll be interested if staff has thoughts. This is the first time that's come up. I guess I will say that if you are touching a meter, or if you're outside, you should always wash your hands before touching your face in any way. So that's a health perspective. With respect to consumer activity, our biggest focus really has been winterizing our outdoor seating areas safely. So I don't know if you have additional thoughts, Mark.
So thank you, Matt. 2 things. One is the question about touching parking meters. I know this does not work for everybody, but using the Park Mobile app on your iPhone, and also we have another alternative. I don't even remember what it's called. It's called the Parkulator. You can get these machines that you can use inside your car. They're little sort of electronic devices. I would encourage people to use those. And in addition, the question about the parking hours, I think that that is something that, as you said, was adopted 2 budgets ago. It's not something I'm anticipating we would change at this point. And I would just note that I've been out a fair amount. The parking situation has actually been a lot more reasonable if you're looking for a space. Even though we have taken away a few of the areas along the curbside for parking for pickup and drop off, and also for the TOSAs you you mentioned. So if an individual ever finds themselves in a specific circumstance where they cannot pay for whatever reason, just make note of that. And I think we're always very flexible on those circumstances. So that's what I have to offer.
Thank you, Mark. Certainly appreciate that recognition of those who might be in dire need, in urgent need of the ability to pay for parking. It can add up. I do use Park Mobile, and I think many do as well. So I would tend to align with your thoughts as well. Over to you, Katie.
Thank you. Okay, so let's talk testing. Questions about rapid antigen testing in particular. Perhaps I can invite Dr. Miller to join in here and maybe give our public health director a break, since I know with your public health background and conversations, you've also been helping lead up the county's testing approach. So can you just give us an update on what the county is doing with regard to providing testing, particularly for uninsured or underinsured Arlingtonians? And maybe just a little insight on this issue of the day about rapid testing relative to the more traditional nasal swabs and what those are telling us for both individual health and public health purposes.
Thanks, and good afternoon, everybody. Just a general update on testing. As Mr. DeFerranti mentioned earlier, the county's test positivity rate, so the percentage of positive tests, still hovers somewhere around the 3 to 4% mark, which is promising, and shows that the public health efforts taken not only by those in our community, but also by businesses and others, it's really having an impact. And so thank you everyone for that. The county continues to maintain the operated sample collection sites at Arlington Mill, as well as at the North Quincy drive-up site in partnership with Quest. To date, we've had 11,650 total PCR tests administered through these county sites. That includes our pop-up sites that we've had. That accounts for about 20% of the total testing done within the county, and so we're pleased to see that. Our 7-day moving average of tests available is somewhere in the 450 range, and we continue to want to see more access and availability, as you mentioned. As a result of that, we're doing a couple of things. One is the hours at Arlington Mill. So Arlington Mill, once again, especially for our uninsured, underinsured, low-income residents who otherwise don't have access to healthcare systems, that has expanded hours. And one of those expanded hours actually is this weekend, actually Saturday, the first Saturday of every month. We do have testing available, and we'll make sure to put the link available in the chat box so that folks can see that. And then you mentioned the neighborhood level pop-up events. So we've got around 300 tests that are available at these events. We find that that's about the amount of demand that we see. And we're going to continue to have those on a rolling basis so that we can really bring the resources to the neighborhood level to reduce the barriers, whether that is the use of transport to get there, whether that is hours, because folks are working and it's otherwise not available to them. And also, an important thing about these pop-up ones is we're beginning to utilize saliva-based collection methods. And we find that reduces, first of all, the amount of personal protective equipment, the PPE that we have to use, but also that it reduces the barrier that some people have in testing, because we know the nasal pharyngeal swab is uncomfortable. So with that out of the way, I'll briefly talk a little bit about rapid antigen testing. So you may remember that about a month or a month and a half ago, the governor announced a partnership with a number of different states to procure these rapid antigen tests. And without getting too scientific, the rapid antigen test actually detects the protein that is present within the body as it relates to reaction from a virus being present. So the PCR test is actually testing for the presence of the virus. The antigen tests test for a specific protein. They do have their uses. They do have their particular use cases when they will be when they are beneficial. And I'll let Dr. Varghese talk a little bit about that and the science behind it. But the state has still not finished negotiating and procuring those rapid antigen tests. and they're also developing the strategy that they want to roll out statewide. So remember, in the Commonwealth, the testing restrictions are set at the state level by the state health commissioner. So things like the necessity of medical screening, doctors' referrals, and the types and methods of testing are set at a statewide level. And so we're anticipating VDH, the Virginia Department of Health, to come through with that guidance hopefully very soon, and with a strategy to be able to implement those antigen tests where they make sense and where we can have the greatest impact. Dr. Varghese?
Thank you, Aaron. So some of the context that I want to talk about the rapid antigen test, it makes sense in the way the state has been pursuing it initially for places like nursing homes and assisted living facilities, that it collaborates with what the federal government has done, putting it in places where you have fixed populations, and that getting rapid results could help the nursing home or assisted living facility potentially move patients to what we call cohorting the sick and keeping the well in a separate area, and then you can then cohort staff, those who only deal with the sick versus those with the well, to reduce the risk of spreading germs within a facility. And obviously getting a rapid result in those areas would be helpful. Many of the rapid tests that I'm familiar with still require a certain level of skill in collecting the samples and doing it in a uniform way, which is why it's not like a home pregnancy test yet. So when it gets to that level, hopefully that will be available, and we're hearing things happening across the world trying to improve those things. But most of the scenarios still require a healthcare professional to administer the rapid antigen test. So it's a very sensitive test. It may not be as, it's a very specific test in many cases, may not be as sensitive to detect the virus, which is why in a diagnostic situation, if we're trying to see if you really may, if I'm a clinician who's diagnosing any of you individually, I would probably still go with the PCR test, because we're trying to make a sensitive diagnosis and picking it up. So the rapid antigen tests are really on a population basis, which is why the nursing homes would be a great place right now. If we needed to ever put it in a jail, for example, if the need was there, so far we haven't had that, that would be a more appropriate place at the moment for the type of rapid antigen test that we have.
Thank you. That was really helpful, and I think that deep dive into the science helps clarify as well why different tests are appropriate for different scenarios. One quick follow-up on testing while we're on the subject, and then I'll turn things back to Matt, is a question about how is testing that's performed by someone other than Arlington County, like Virginia Health Center or at a CVS or at Preston's Pharmacy, incorporated into Arlington's testing numbers. Could you all tell us a little bit about how VDH collects that data from non-public sources?
Sure. So actually our data and most of the major healthcare institutions and lab centers have electronic feeds into the Virginia Department of Health and across the nation. That's how the majority of this is done. A lot of the rapid antigen tests have been more standalone efforts in doctors' offices, perhaps, and they don't always have electronic feeds, and so there may be more of a delay in getting those results, both positive and negative, in the system. And that's just the reality of we are flying the plane as we're building it, as I think everyone has recognized in 2020. So I wish I could say it was a seamless process that's always within 24 hours, but in the haste to get more testing available, sometimes you may have more testing opportunities and there may be a delay in the reporting of that to public health. But we keep working to, whenever we identify data that's late, like, can we correct this solution for going forward? Is this a doctor's office that, doesn't know there's an electronic system that they could type the information into, for example? And we do that not just in Arlington, but throughout the region, because we know that people get their health care not always in Arlington. That's how it's traditionally been. And so we need to remind people we're all part of this together as a region.
Thank you. That was really helpful. All right, Matt, over to you for the next question.
I'll get to a question. We got a question a little bit on voting outside, but I first want to just take a second to that answer from Dr. Varghese is a perfect example of the professional, careful, and thoughtful staff leadership that we have from Dr. Varghese, Dr. Miller, both Mr. Schwartz, who still are not related. Just, you know, it has been a marathon, and I think as a community we feel that, and we only need to look at the resurgence in cases in France. I heard a short story, and it is a whole resurgence. And of course, irrespective of your political views, the president testing positive, this is an ongoing challenge, and I think we're all exhausted, but we also must continue to be relentless and professional and work to keep people safe. So just a big thank you to our senior staff. As I can't tell you how many Saturdays and Sundays I know Dr. Verghese is on calls most of those days, in addition to the 5 days of the week. So each of us are grateful for our senior staff in that regard. Voting. The question is about outdoor voting, and we have talked about. We have a new space at the courthouse, which formerly was a Wells Fargo bank, and now is we passed a couple weeks ago authorization. So early voting at the courthouse is happening through a very open set of doors, and it really is nearly outdoors, even though there's a roof over that space. With respect to other drop boxes and possibilities for outdoor ways of delivering your requested mail ballot, I think there's some work on that. I don't know if we have an announcement just yet, or it's a stay tuned, but I think, Mark Schwartz, you've been working a little bit on this, and I know the board has been concerned too.
So as to outdoor voting, as recently as 45 minutes ago, I was outside on the plaza taking a look. I know I'm going to regret saying this. The lines were short, so if you want to go vote, now's a good time to do it. And that's at the old Wells Fargo Bank at 2200 Clarendon Boulevard. As of October 17th, there will be additional satellite voting locations open. And I know I'm going to miss something. I think one of them is at Langston Brown. One is at, oh boy, I'm not going to guess. We'll post it on Facebook and in the chat box. Oh yes, Aurora Hills, and Madison, and Walter Reed are the places. And in addition, we have on order drop boxes, which will be installed at each of those locations, and potentially we need to get them. They're hard to come by, but we're also thinking of having them installed at Central Library and potentially 2 other locations, one being Arlington Mill, and I think another one to be determined. So many opportunities. Also, if you come to the Wells Fargo site, there's a place along the curb out front where if some people obviously cannot come out of their cars because of their physical condition, where you can actually vote right at the curb.
Great. Well, the drop boxes at the 5 early vote locations, they're coming. So the answer to that question, which I know I also got via email a couple days ago, is yes, we're getting there, and more progress to come on that. So, Katie.
Great. Thank you so much, Matt. One of the things as we're waiting for more questions to come in that I know our team has been working on pretty hard is collaborating with businesses and ensuring that our small businesses can, keep their staff retained and avoid layoffs, but also do so safely. Mark Schwartz, I wonder if you'd like to speak to some of those efforts, even just beyond the temporary outdoor seating areas, about some of those collaborations and resources that are available for small businesses in particular.
So thanks for that question, Katie. The Arlington Economic Development and the with the Biz Launch program, we have, in addition to the grant program that we had rolled out earlier, where we were giving assistance to between 300 and 400 small businesses who applied for grants, has a number of seminars that they are holding. I think that they've had at least 1 or 2 this week with tips for small businesses on how to make it through what has been an extremely difficult situation. And we also have been providing some, I guess you say technical advice to small businesses and also to restaurants about what they can do to improve their situation. And I'm not going to try to sugarcoat it. It's just been a really, really tough time for our businesses. We've the Chamber of Commerce and some of the other organizations in the county have been working also to provide assistance. And then I'm keeping my fingers crossed. I think there's a chance that Congress may actually act and adopt another piece of legislation which built into it has additional assistance for small businesses.
Thank you so much, Mark. And we have had a question come in as well on the issue of restaurants and lines, which is something we've heard a lot about. You have seen us try to combat this in a few different ways, some more successful than others. But the question of why are restaurants still open and why are bars in particular still open is a good one. Because of the way alcohol sales are categorized in the Virginia State Code, across Virginia, you actually don't see many classifications as bars. What we have are restaurants. And so any rule that applies to restaurants, which again is set at the state level, applies equally to the pizza shop as it does to something widely perceived as the bar, which is maybe a short answer to part of the question, why folks have been interested in why Arlington hasn't closed the bars. So twofold, they're restaurants and have to be treated the same as any other small business restaurant. And also that those decisions have been set by the governor, the state level. One of the key ways that we've been trying to combat the long lines, the crowding, or the potential for spreading has been through the Arlington Restaurant Initiative. Those who are interested may find it of interest to go follow our most recent board meeting, our recessed board meeting from September 15th, I believe, and get an update from our police about some of those efforts. We have seen a dispersion of some of those lines. Hopefully you'll see some of those lines for our question and commenter as well. And if you have ongoing concerns, we can post a link in the chat about where to report those so that public health staff, police can follow up and have a conversation with the ownership or managers of those restaurants to help ensure that people are congregating in a distant way and safely and wearing masks. All right.
Got it. So I think that's most of the questions, Katie. Is that I don't see any. There's a question about cooperation with DC and other jurisdictions, and we talked about it. I'll just succinctly say we continue to cooperate both at the county manager level and at the public health director level with our neighboring jurisdictions on a regular basis. So, you know, I do think it's important. I believe the last 2 days, our test positivity rate has been 2.9%. Dr. Miller might quibble at the 3% as the average area, but we have been, the data as we've been seeing these both regionally and in Arlington have been fairly positive. And so thanks to everyone for joining us this week. We still are getting questions. We're still doing this. We did a town hall in Spanish last Thursday night. We have the pop-up targeted testing to try and reach populations like our Latinx community where there's been higher case incidences. And we encourage you to visit our county COVID website at arlingtonva.us/COVID-19 for additional information on reopening and the pandemic response that our team in Arlington is continuing to bring. If you have additional questions and you'd rather talk via phone, 703-228-7999. And I know there's a couple of other points that I'm sure you'll want to make, Katie, perhaps regarding the census, that great event you did, and then a couple of just reminders that you may want to close us with.
Of course. Thank you so much, Matt. And thank you to those of you who've joined us today and for the very good questions on some of the issues that are top of mind for us, as well as for you all, about testing, distancing, and so on. So thank you again for joining us. A reminder, Arlington is closer than ever to getting a complete count in the decennial U.S. Census. In case you're not following the trials and tribulations of the court decision, the good news is that the courts have determined that we can keep counting through October 31st. So please, if you haven't already had the opportunity to be counted, visit census.gov to learn of the ways to be counted. Ensure that Arlington is fully represented and fully counted, because everyone counts. So thank you. Please be safe. Take care of yourselves, your families, one another. And I know that our colleagues will look forward to joining you all again in 2 weeks.